Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Studio. And I am super excited to have Dr. Duke Johnson on today. He is with the Heart of Hope Health Clinic in Post Falls, Idaho. It might not be Post Falls. It might be Hayden. He'll have to clarify that, but it is in northern Idaho. I have had the pleasure of visiting that clinic. Got a super cool story behind it and super cool plans that we're going to discuss for their growth. So without further ado, Dr. Johnson, welcome to our show.
Thank you very much, Shawn and Janet. It's wonderful to be with you.
Yeah, thank you so much for being on. So tell us a little bit about the history of your clinic.
Well, it's really a fascinating history because we really had nothing to do with it. It really kind of originated in the last couple of years with people just feeling uncomfortable with how medicine was changing as far as management and implementation is concerned to patients. And with mandates and requirements, which was completely different than we've dealt with in the past, a number of healthcare professionals, both doctors and nurses, got together September 16th of last year in North Idaho and basically said, well, you know, we feel uncomfortable. What should we do? There should be an alternative. Let's provide some options for patients who might not want to go down certain pathways. And so we met, and we really didn't know what to do. And then the only thing we decided was to meet the following week. Well, the following week we met, there were 200 people in the room. We had state senator and congressman and lieutenant governor and all kinds of people showed up for the meeting, and there was a tremendous amount of interest. And a gentleman showed up who has a ministry. He was moving to North Idaho, and he said, I feel as if God told me to help you guys, and I need a headquarters, so I'll buy a medical building and I'll operate out of it, and you guys can lease the rest of it and start a clinic. And so all of a sudden we started going down that pathway, and it just kind of unfolded rapidly, and we opened it in February 1st. It took us a few months to get equipment in, and there's also been a donation of land for us to expand to building another facility, and we've just been growing basically since February 1st, and it's just been amazing. We feel as if we have nothing to do with it. God's doing this, and we're just sitting back watching.
So tell us what makes your clinic different.
Well, what we've done is we're operating on what's called the DPC model, direct primary care, where we function basically taking memberships with people and operate and don't accept insurance or Medicare. So we don't bill them. If people wanted to maintain their insurance, we provide the ICD-10 code so that they can bill themselves if they would like. But everything is run on a membership. And so what that does is that it frees us up so that in essence, we can implement treatments that we believe are best for the patient themselves. And I've got a long history in preventive medicine of over 35 years. So my view in the first place is different than most people. And that allows us to be free to be thinking proactively instead of reactively. And we've had some really great success stories, and it's just fun to be involved.
Janet.
So what is the staff feeling? Because I'm sensing that there's a little bit of excitement, but there's a difference too between where you were before you started and where you are now. So kind of the journey of how people are reacting and how they're feeling.
You mean staff or patients or both?
Staff. Your staff.
You know, it's really interesting because we really didn't know what we were embarking on when we started. It was let's just do something, and that's where it originated. And so there was kind of like it's almost like a panicky situation of what do we do? How do we do it? We've never created this before. It's an alternative pathway. And how do we go about doing this? What's the best way to do it? We were getting a lot of consultation and input, and through a lot of prayer, we finally decided to go down pathways. And with that, with any changes you're going to see, of course, we're going to, people had some perspectives that it should go a certain way and others, but we finally could really see a clear path that was working, that was smooth and operable. And then we brought in people with expertise in certain areas to be able to, handle and deal with those differences and those changes. So we've finally become. It took a few months, but now we're really, operating very smoothly and have some very, very talented people that we're surrounded by that are very gifted. So it's fun.
So you mentioned you don't bill insurance, so your clinic must be really expensive. I'm joking. So tell us about that. Tell us how healthcare can be affordable.
Well, the money doesn't go to big buildings in big cities. It actually goes to providing for the patients and for the staff. And so, to be a member, the primary and the family pays $100 a month, and a spouse would pay $75 a month, and then children are $29 a piece, up to a maximum of $250 a month for a family. And so what that does is that anything that doesn't cost us anything, we don't pass it on. That's just, how we're functioning. And so, if someone needs a splint or suturing, et cetera, that's all included as part of the fees, because that doesn't cost us hardly anything. And they can come in, multiple times in a month. That we're not limiting the number of visits per se, unless somebody just really overtakes advantage of it. But nobody has, and so a lot of the things that a lot of offices bill for, we don't, because we just want to make that directly applicable to the staff. And what that does, though, is that it then frees us up so that we're not trying to run patients through here as fast as we can. Most offices are paid on how many people they can get running through an office, but when our foundation is this model, then we don't have to race patients through. So our typical appointments are an hour long, and I've had a career that's a long career in medicine. I started off in emergency medicine, and then I had a family practice, myself and another doctor, of over 8,000 patients. And so in that time period, I was seeing 35 patients a day, and I know how to run patients through really fast. And I was working prior to that in an emergency room where it wasn't unusual for me alone in the emergency room to take care of 50 patients in a shift. So I know how to go fast, but that's not the kind of medicine I enjoy. And then after that, I became medical director of the largest supplement manufacturer around the world, and have taught preventive medicine in 30 different countries around the world. So I've got a real vast array in my experience. And in those time periods where I was seeing patients fast, there's only so much you can get to know. But now in this scenario, I can really get to know patients, and I can see things that it's impossible to see in 10 or 15 minutes, et cetera, et cetera. So, so what we do when you think of insurance, basically, you think of office visits and catastrophic. Well, we're the office visit, in essence, of that DPC. And then there's other people out there that are covering the catastrophic, they're like, Samaritans, or, there's about 12 organizations that we know of that you use a similar approach. And those usually cost about $450 for a family. So we've got statistics that show that if you use a DPC and then a shared catastrophic cost sharing group like Samaritans or whatever, then what you're doing is it costs the average family of four around $900 a month. But if you go the insurance route, it's very commonly $1,400 a month. So we've got statistics that show the average family going down this pathway may well save $7,000 a year by going down this pathway. So once the patients understand that, then they get excited about the cost savings involved, and then the long appointments. And so it's really, when people started to understand what was available, then momentum really has started to build. And so it's been exciting to see the change, and we're really enjoying it.
I think with the health sharing ministries and the DPC model, I think honestly you're being pretty conservative, because I can tell you for our family, we pay $170 a month through Christian ministries, and we love it. And, so along with a DPC membership, you're talking like, a little over $300 a month, whereas insurance for us would cost 1,500. So we've done the calculation. It's anywhere from, 12,000 to $18,000 a year that people can save. And that doesn't include the lab fees and some of the other auxiliary services that you guys provide, because many times labs are cheaper by paying cash than going through insurance, correct?
Oh, absolutely. I mean, and we don't have any deductibles or copays. So, and so, yes, definitely the cash price for labs is extremely competitive, and we're just passing along those costs. So whenever we're incurred something, I mean, a lab that may cost through an insurance program $70, it might only cost us 13 or something, and so then we might charge the patient 15 to cover Band-Aids and nurse time, but we're not trying to make money on that stuff at all. We're just focusing on the DPC portion of it, and we just want to make a living and take care of people. We're not interested in being the biggest or the brightest or whatever, but I've been called by a lot of people to say, hey, what is it you guys are doing? Because we want to do it too. so I've had a lot of discussions with that from many people from many different states. So it's been quite a ride, actually.
Well, I've noticed, you guys haven't really officially been in business even a year. And how many providers do you have now? 4 or 5? I don't think they're all full time, but can you tell us about that?
Yeah, actually, it's kind of interesting. Like right when we opened the door, I had phone calls, and I don't know how people got my phone number, but I was getting phone calls from people in like 16 different states, and how's this happening? Right? What's going on here? And they were either saying, how are you doing it? Because we've tried to do it in our state and it's not working, or our location, and or do you have any openings? I'd like to join. And so we've got a lineup of people who would love to join us. And so we interviewed a lot of people who were interested, who'd heard about it right from the start, and started down that pathway. And so, yeah, we have four healthcare practitioners right now, and we're adding them as we need. And so, in other words, we don't want to take away from anybody, but as that volume increases, then they can expand full time. Then we open up another position for a day or two a week, and we're just going to keep expanding accordingly. And so, there's been a definite interest in us either joining us or having us teach people how to do it.
Janet.
So we have interviewed many practitioners and healthcare professionals over the last couple of years. And one of the things that I think I'm sensing is that there's this new feeling of, hey, we're taking our profession back and we're actually happy. Because one of the things I think we have seen, even in our own profession of pharmacy, is burnout, like the mental burnout, the fatigue of working all these hours and not having that professional satisfaction. And so really what I'm hearing from you is just a lot of excitement on all ends. Like the patients are happy. They're happy with the services. You seem to be super happy. So any stories of providers that you have working for you that, you can touch on and how it changed their life as a professional?
That's a great question, Janet. Actually, yeah, we have a healthcare practitioner who just really didn't like to be, told the mandates of how she should take care of her patients and how many, shots they should receive, or how many, what were the exact protocols. She just wanted to have the freedom to take care of families the way they were. And so when mandates came through, she actually went to another state to get some assistance or to find a location where she could work, and was there for a little while and had interviewed and then found out about us, and then came back, and she's loving the opportunity to just treat patients the way she always used to meet their needs and to not worry about, I have to have so much filled out in such a short time period to meet certain criteria, to meet certain standards and goals that I'm being watched over. And so she spends a lot of time with the patients. Her reports are like incredible. They're way more inclusive than she would be able to in an automated system. And I mean, I love reading her reports. They're like amazing to me because she's detail oriented. She's a fantastic healthcare provider, and spends a ton of time with the families and children, and just really invests in their lives. And so she's as happy as can be, because this is the kind of practice she always wanted to have. And for me, similarly, I mean, I can't explain when you don't have that time pressure of an organization telling you that you're not seeing patients fast enough. Because for a short time period in my career, my family practice in Southern California was bought out by a larger organization, and they had supervisory doctors who'd say, okay, well, this was your volume this month, and what's your volume, your volume needs to be next month, this number, and can you come in and work on this day, and can you do half days on Saturday? It was all about production. And I don't think a lot of physicians got into healthcare to say, wow, I don't really care about anything other than how many people I can see in the shortest time period. I mean, I don't think most people got into medicine for that reason. It was to truly help people and get involved in lives. And I've gone into rooms where a patient would list in the front desk that they were there because of a sore throat. And I'd open the door. This is in my family practice in Southern California. And I'd open the door and I'd say, hi, and they'd start crying. And I thought, okay, they're not here because of a sore throat. There's many deeper issues going on in their family, and there were marriage problems and stress and not sleeping, and the family was falling apart, and they took any appointment to be able to be there, just to walk in the door, to be able to communicate with me. And I'd have this big lineup of patients, and I started off by saying, spending the time, 20 minutes or 30 minutes. And I said, well, why don't we come back? And so I can really devote a lot of time, and let's spend an hour appointment or whatever with you. And most of the time, those patients never came back. It took everything in the world to come in the door. And so we told the rest of the people in our practice that your appointment times are relative. Take a book. There may be needs that are going to need to be met, and we want to meet those needs first. And yeah, you might spend some extra time in our waiting room, but if you ever need something, we'll be here for you. And out of over 8,000 patients, we only had about 20 leave because they just demanded a doctor who was perfectly on time. Most people, essentially everybody stayed because they wanted that kind of care. Well, in this scenario, we're able to provide that kind of care again. We're able to just say, yeah, these are an-hour appointments. What's going on? How can I help? What do you need? And we can spend a lot of time going into issues. They don't have to. Right when we open, people come in with a list, and they were talking like, there used to be a commercial on TV where they had this guy who could talk incredibly fast. I don't know if it was FedEx or somebody, and that's how patients were showing up, kind of like blah 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 blah. It was like, no, hold it. You've got a lot of time here. No, just we can talk about these things. And people were so, yeah, exactly. They were so shocked. It was great.
Well, it's super exciting to hear, because I will tell you, in the last couple of years, the conversations I've had on the phone with clients, there was a lot of despair. Like, where should I go? What do I do? Who can I see? And so it's really super exciting on my end, because, we talk to our clients a lot over, several, just because I think pharmacy industry is like that. We see our clients or talk to them quite often. And so it's super exciting to see and hear that we have that coming back, because I grew up in a little town where, that doctor was at the game. And when I sprained my ankle, he's the one that fixed it. And then he looked at it and you followed up with him. I mean, it was the hometown doctor. He knew everybody in your house. And so having those relationships rebuilt, I think, is what we need to do in healthcare to get just even the confidence back. I feel like we have destroyed confidence in clients with this next approach. And I understand where providers kind of gotten stuck into that, but it's exciting to see that we're taking it back and saying, no, we're going to take care of our clients the way we feel is appropriate, which it takes some guts to do that. So kudos to you.
Well, it's really kind of funny. I don't feel in any way, shape, or form like I'm fighting anybody. I feel that what I want to do is just provide healthcare the way I think it's best for patients. And that's why I got into medicine a long time ago. And I've had a lot of patient visits in my career. My wife and I calculated one time, and we estimate, obviously I didn't keep track of all of these, but we estimate in my career I've seen 150,000 patient visits. And but I didn't get into medicine to see a ton of patients. I got into medicine to take care of lives. And I absolutely enjoy what we're doing. To me, it's like, everyone can do whatever they want to. They can have the reasons that they do what they want to do. Some people are so firm in their stance. It's like it's not even worth talking. But when I represented a multi-billion-dollar company globally, and you're standing on a stage in front of 10,000 people, and you're representing a huge company, you have to really know your science. And a lot of the people in the audience were very science-oriented or medically oriented. And so I really know how to dig into the literature. I really know how to find the truth of studies. I just don't read conclusions. I tear them apart. Who were the subjects? Who are the people? How did they structure it? What were the statistics they used? Can they use that in this scenario, et cetera, et cetera? Who are the people who are excluded from the study? And from that, I've been able to be able to really understand in such a way what is the best way to approach people in a great deal of situations. And if I don't know how to do it, I know which specialist to call to help me with it. I'm not trying to know everything for everybody by any means, but to be able to just then do that and transfer that on to other people, where they can feel loved and cared for. And I think this is a pathway, and he explained everything to me, and they go home feeling like I'm being cared for, then I've done the good job.
So you mentioned early on in our show, even in the short time you've been open, you have some stories. So tell us the most satisfying story for you, where maybe a patient either you really changed their life, or you saved them a lot of money, saved them a lot of time. I'm sure you have many of those, but tell us one of the ones that sticks out in your mind.
Well, there's actually two that stick out in my mind, and actually we've decided to film these and put them on our website. They're just really fun stories. The first was a gentleman who had a real bad experience with COVID, and so a relative here asked me if I would give him a call. He lived in Colorado. He says my relative does, and so I gave him a call, and the scenario was I gave him a call like May or so of last year, May of this year. And his experience was that in September of last year, he was mandated to take the shot or he would lose his job. And so he held out to the last day. And this is a gentleman who's a terrific athlete all of his life. In fact, I think he was all-state in wrestling, and he's about 50 years old, and he still plays hockey about 4 to 5 days times a week. I mean, this man's an athlete. He's and about 3 days after getting the shot, he got COVID and was having such difficulty breathing. They admitted him and started him on remdesivir, intubated him, and then he was in a coma for 2 months. And so he was discharged from the hospital December 24th of last year with a walker and an oxygen tank. And basically physical therapy didn't do much for him. And that's pretty much the condition he was in when he called, or I called him. And I said, well, you need to find somebody. We found out about FLCCC's protocol with Dr. Paul Merrick and Dr. Peter Corey, and we just kind of use that as a basis. Everyone who comes in, I vary how I approach people, because everyone has a little nuance, and even Dr. Corey himself says every patient that comes in, I saw a talk he had a couple of days ago where he goes, every patient that comes in is a learning experience for me. So he's still in that investigative mode himself. But I told him he needed to find someone in Colorado that would do FLCCC. And he called me back 2 days later and said, I can't find anyone who will do it. Can I come drive there to your office and see you? And I go, okay, sure. If you want to make the drive, of course. And he was feeling, and when we saw him, it was, we don't have a big office. I mean, you guys have seen it. And to go from the parking lot into our waiting room was a big event for him. And then to go from the waiting room to the patient room was quite a task. And so he was feeling so much better in 4 days. He said, "Can I come back and recheck in a month here?" And I go, "Well, of course." So he came back in a month, and when he showed up, he no walker, no oxygen tank, walks into our waiting room like nothing, walks into the patient room like nothing. And he's sitting there, and I'm rather stunned and thinking, "Wow, he looks great." That's what I'm thinking inside. And I go, "So tell me, how are you doing?" He goes, "Well, I'm better." And I go, "Okay, well, tell me about it." And he goes, "Well, when I play hockey, I have to sit down and breathe oxygen after about 3 minutes." Like he's upset at me, right? I go, wait. And I looked at his wife and I said, "Did I hear that correctly?" And she goes, "Doc, it made me cry when he got back on the ice because he loves it so much." And so I said, "So you're playing hockey?" And he goes, "Yeah, but I have to sit down after 3 minutes and breathe oxygen." I go, "Wait, hold it. Let's be patient here. Let's take some time." And he goes, okay. And so he's continued to get better. He's not fully back, but he has radically changed from what he was when we first saw him. Another gentleman is a substitute teacher. It's in his high 60s. And he had another bad reaction. In fact, right after he was injected, he immediately felt neurological problems, and such that his wife had to drive home. And they told him, "Oh, this will go away in a couple of days. It'll be no big deal." And so what he did was that night he tried to go to the bathroom and he couldn't. And he couldn't even walk, so he couldn't get off the floor. His wife couldn't help him get off the floor, so they called the paramedics, and the paramedics had to help him. And the next morning he could not walk, and so he saw a ton of people who thought he had some sudden onset neurological disorder, and he was in a wheelchair, and saw lots of specialists, lots of scans. Nobody could figure out what was wrong with him. And he was injected February 22nd of 2021. And so he had been like that for 15 months when I saw him. And in fact, when we started the treatment, when we weighed him at check-in, I had to hold his belt up so that he could stand on our scale. He literally could not stand on our scale. He had to hold the wall, and I had to hold his belt. And in 1 month, he was, when he came back for recheck, he was walking the length of a basketball court with a walker. And in 2 months, he didn't need a walker or a wheelchair anymore. And so we just filmed him just recently, because now he's ready to go back to teaching after being in a wheelchair for 15, 16 months.
Wow. Incredible story. Thank you for that. So your clinic is expanding, and you've got, I know, some grandiose plans. So let's talk about what you are currently expanding into, and then what your overall long-term goal actually is.
Well, it's really interesting because we have so many healthcare practitioners that are interested, and so many people in surrounding cities that are interested, that we're looking to take out leases in surrounding cities and maybe place healthcare practitioners in those cities to just basically duplicate what we're doing. It's almost kind of like a franchise idea, because apparently a lot of people it hasn't clicked, and they kind of don't know how to do this. And for some reason it's clicked with us. We just have feel comfortable in how to approach this whole issue. And we've actually had land donated to us. We had someone says, "Well, if you want to build I think you're going to need a hospital. And so, you're going to need land, and I'd like to donate it to you." And so that gentleman showed us 10 acres and then 16 acres and then 45 acres. And he says, "Which one do you guys want?" And before I could even answer, I was just shocked. Before I could even answer, someone walked up to us and said, "Oh, they're going to need the 45 acres. And the landowner said, "Well, that's what I wanted to give them." So he's donated that. We've had it rezoned so that we can build, some kind of a larger treatment center on that. So it'd be a little bit more of a referral center, and we're just waiting for the money to come in to expand, to begin construction on that. But we've got the land as a basis. We're we're growing every day. I'm seeing new patients every day. All of the other healthcare practitioners are. We're adding new practitioners as the need allows, but we're just adding them as they can. We'd like to spread it as much as we can to see what happens.
And you guys are expanding into urgent care and expanding your hours. Is that correct?
Yeah, and so that's what we're doing right now in our Hayden facility. We started in Hayden Lake, and so we're looking to basically expand this facility from being primarily family care to being both urgent and family, and then doing that at several other locations so that it'd be both a combination of family and urgent.
What are some services that you've added or going to be adding, like X-ray and things like that?
Yeah. In fact, most urgent cares have some basic labs. I mean, certainly we have a lab company where we can have them drop by and send out or have them take to their lab, stat labs, et cetera, like most any other urgent care does. But yeah, we've already got ultrasound, and we're adding an X-ray machine. We're actually going through remodeling of our facility right now to bring that in. And also, the basic labs per se, so that we'll be able to handle. I've worked for years in an urgent care. We've got healthcare professionals here who've worked in urgent care, so we know what to do to create such an entity, and we feel real comfortable in going that direction. Then I used to work ER, so urgent care is something we feel comfortable to expand to.
So, if the patient is a member, will the X-ray or the ultrasound cost them any extra?
Well, we're going to have to see, number one, the cost of the machine, and then what the turnaround is going to be as far as that's concerned, what the cost is to us. If it's minimal or small, then we won't add to it. But chances are there's going to be some overhead with that we'll have to pass on, just like we do the labs. And so it won't be anywhere near what you'd normally have at a big facility, but at the same time, we're kind of anticipating we're going to have to pass some of that along, like we do with the labs.
Are those services like ultrasound or X-ray, are they going to be accessible to people that are non-members possibly? Because I know sometimes it's hard for people to get an X-ray without being charged $600 at a hospital.
Exactly. No, and in fact, what we're planning on doing is a fee for service. We already have a fee for service. So we're seeing people right now that they don't have to be members. In fact, the vast majority of people, they come in as, I want to do a fee for service, and then by the time they leave, about 80% of the people, by the time they leave, they go, okay, I want to be a member. They do the fee for service as a trial. Although we have some people that stay fee for service, and that's fine based on their finances and their insurance and their needs, and so it's just whatever works for them. But definitely with the urgent care, yeah, we'll also have that kind of a scenario too, where if people want to just do a fee for service, yeah, absolutely, no problem.
And so what do you have a passion for? As we wrap this podcast up, Dr. Johnson, what do you have a passion for?
I have a passion for life. I just have fought for life in all aspects of my career. I've loved preventive medicine, which I've been involved with for 35 years, because I want to help reduce the risk of chronic disease in people's lives so they can live longer and healthier. In my global travels, I've been in very dangerous countries because the major corporation asked me to go in to speak, and I've been in places where the State Department told on their website no American to go into certain countries, and I've gone in because those people requested our help with their health, and I'm happy to do that kind of stuff because I don't see it as I'm here for me. I believe that God gifted me and that I'm to serve Him and His people, and that's what I'm supposed to do. So that's definitely what drives me.
So what is the best way to get a hold of your clinic if anybody has any questions?
Well, our phone number is 208-500-0601, and our email is heartofhopehealth.com. All four words are just made into one word, .com. So either of those two ways are pretty easy.
Awesome, Dr. Johnson. You have helped realize our goal of educating and empowering individuals to take charge of their own health. I'm super excited for what you guys are doing and super excited to see you guys be so successful at it because we definitely need more clinics like yours. The last 2 years have definitely showed us that, and patients want choices, and I'm so glad that you're offering this. So thank you so much today for being on and taking the time.
Thank you, Shawn. Wonderful to be with you. You take care.
And listeners and viewers, stay tuned for Thursday, 8 a.m. to 9 a.m. We will have Dr. Yazan Abdullah on. He's going to be talking about men's health. You don't want to miss out on that. We talk a lot about that on this podcast. So tune into that 8 a.m. to 9 a.m., our midweek podcast right here on my personal Facebook account, the Mosaic Professional Pharmacy Facebook and YouTube site and Twitter and LinkedIn streaming live. So thank you all so much for tuning in today and listening to Health Solutions with Shawn and Janet Needham. Thank you.